assertive community treatment team. So I've had an opportunity to really see like different phases of care, from as high as inpatient, emergency services, and outpatient services, which has served me incredibly, it has been incredibly helpful in my current role, because one of the things that we currently deliver is not just outpatient services, but a lot of case management and care coordination with our older adults. So I would like to start today's presentation by just giving you a bit of an overview of what senior adult mental health is, what kind of services we provide. I received a list of questions early on that I actually included in the presentation as well, so we'll be able to touch on all of those points as well. Okay. All right, so a little bit about the Senior Adult Mental Health Program, or SAM for short. Our team is a multidisciplinary team that provides services to Arlington County residents that are 60 years and older that have been diagnosed with a severe mental illness. All of our services are offered on a sliding scale. We accept Medicare, Medicaid, as well as third-party payments are also accepted. And very importantly, individuals who are not eligible for benefits due to not having a permanent legal status in the United States are also eligible for services, which is another area of need as well.
So does that mean bilingual and other languages?
Yes, we currently have on our team 3 staff members that speak Spanish, myself included. We have our psychiatric nurse, Francisco Torres, is bilingual, and another staff member, Magali Vicente, speaks English and Spanish. 4 staff, actually, Erica Sobel, and myself. So our team includes 1 psychiatrist, 3 full-time clinicians, 2 part-time clinicians, 2 full-time case manager, 1 psychiatric nurse, and 1 program manager. One of our full-time case managers is actually a position that we just were able to develop in our program in order to provide intensive case management services, which is state-sponsored. And a little bit about the services that we provide. So we provide case management services, medication management with our psychiatrists. We do a lot of coordinations with doctors and other treatment providers in the community as well. We provide therapy sessions, whether it's weekly, bi-weekly, or on a monthly basis. We also provide support for folks that are experiencing substance use issues. Those that are currently, we refer to it as well managed, because in cases in which substance use issues are the principal need, meaning that somebody may require, for example, detox services, then they might require a higher level of care, such as detox, inpatient, intensive outpatient treatment for substance use issues. Now, we are also able to provide substance use treatment on an outpatient basis. And we also provide social assistance to provide the quality of life of our seniors, meaning linkage to services in the community. That's a new one, right? That's gonna go in my book. So linkage to social services, and I'll expand a little bit more as we go on. Our services are being offered on an outpatient basis, that is in the office via secure telehealth appointments. We normally rely on Zoom. And also we provide home-based services for our clients, particularly for those clients that experience mobility issue or have difficulties accessing transportation. Any questions so far? Ready. So a little bit about our current client caseload. So currently we have 159 clients that we provide therapy and or case management services. 58% of them are women, 42% are men. I have included some of the age ranges here for your review. As you can see, the largest age range that we service is 70 to 74. Closely followed by 65 to 69 and 60 and 64. We do have an individual, as you can see, that is younger than 60 years old. This is an individual that actually has been admitted to Mary Marshall Assisted Living Facility. I will expand a little bit more on Mary Marshall. And of those clients, of our total client caseload, these, again, I want to bring to your attention that these are the clients, 159 is the clients that we're currently providing therapy and or case management. We also have clients that receive also medication services only, meaning that their case management needs or therapy needs have been stabilized. So therefore, they don't have a need for continued services. And they have then sort of like graduated to our medication services only. So they only meet with our psychiatrist. And taking all those into account, our psychiatrist currently serves 139 clients, and this includes those clients that are being seen for medication services only. So a question that I hear close to every day is, how do I access services? So that the short answer, I'm sure that many of you are familiar with same-day access. Anybody familiar with same-day access by any chance? All right, so I came to the right place. So same-day access is an initiative by the state that we basically want to help clients access services and get appointments within a 10-day time frame. Okay, so the important thing is that members of the community do not need an appointment. That's number one. They can just walk in and be assessed by one of our clinicians. We are currently in a bit of a transition phase where essentially in order to allow our team to be able to have more resources to actually provide therapy case management services, we're actually sharing same-day access workload with our colleagues across the street in the Behavioral Health Division, or BHD for short. So currently, SAM, our same-day access for senior adults are open from Monday through Thursdays, 9 to 12. One thing that I kind of seem to have skipped is that individuals interested in services will complete a psychosocial assessment with a clinician to determine SAM eligibility. So essentially, somebody will come and say, hey, this is what I'm looking for. These are the difficulties that I'm currently having. So we'll do an assessment, which will include a risk assessment, a case management assessment, and we'll then make a decision with our client and how to best connect them to the most appropriate services, which can be SAM, or it can be some of our other county programs as well. And a perfect example is somebody that may come to our same-day access and say, I don't want mental health services, I don't want psychiatry. All I need is help with housing, for example. So we're not just gonna say, you came to the wrong place, good luck. We don't do that. That's not the Arlington way. So instead, what we do is we connect them to some of our other walk-in clinics, such as the ADRC, the Aging and Disability Resource Center, where they can actually access case management services in a short-term basis to assist them. Yes.
Where is this? If I wanted to walk in or someone wanted to walk in, where would we walk in to?
That is a very good point. I did not include that, but I can include it. I just assumed, but okay. Helen, make a small note. I will add that. I actually added the time, I added the phone number, and I did not add the address. It's a pretty big oversight, but thank you.
I noticed that the 228-1700 number is a number I teach for any older person that wants an answer to any question,
Correct,
not just mental.
correct. Yes, the seven,
If everybody else does not know that, that is the 911 equivalent to any senior looking for help at all.
Not quite 911.
Or
During business hours, Monday through Friday. Yes, that is the number that you should call. Yes. yes.
exactly. So for anybody in the community that has a question about whether it's about themselves, as benefits that they may be eligible, or usually we get a lot of phone calls from family members who are concerned about their aunt or their grandmother. 1700 tends to be the best number to call, because a lot of the times they don't even necessarily know what kind of assistance they're looking for or what kind of benefits or programs are out there. So that's why we usually ask folks to call the 1700 number, and our receptionist will then actually help them kind of clarify, okay, you're looking for mental health, let me connect you to the on-duty clinician at SAM. Or if you're looking for housing, you're looking for SNAP benefit, whatever the case might be, they will redirect their call more appropriately.
We have a question.
Yes.
You're only working from 9 to 12.
So usually when we get calls after hours, which that happens sometimes, we basically work with the client to try to get them to come in the following day. A lot of the times also, the client, because of transportation difficulties, they say, okay, I'm just calling to find out what time should I come in? Can I make an appointment? And most of the time, people are very relieved to hear that they don't need an appointment, that they can just come in. So the reason why we have those limited working hours is because in the afternoon, everybody that does same day access assessments, such as myself, we do assessment. Like for instance, this morning I'm on SDA. I have one of my colleagues that is currently covering me. So as soon as I am done here, I'm gonna go finish SDA, continue my shift and same day access. And in the afternoon, I'm seeing clients. So therefore, we don't have currently we don't have a dedicated team at Senior Adult Mental Health that focuses exclusively on same day access. Our colleagues at Behavioral Health Division, they do have a dedicated team for access as well. So, but nevertheless, we have had a lot of community, we have had members of the community that have come for same day access across the street to BHD, and they have been assessed as well, even though it's past 12. That can also occur, has occurred at times, but usually they have, given the resources, we are currently, we have only those 3 hours to perform assessments, but to be honest with you, we don't find that to be necessarily a barrier currently, because we always work with the client to actually make sure that they are able to come in. And oftentimes when, let's say, for example, that they call at 2 o'clock, we'll say, okay, when can you come in between the hours of 9 and 12? Oh, I can come in on Thursday. Great. What we do is we give them the name of the clinician that will be on duty as well. So say when you come in and you come to the front desk and you say, I'm looking to access SAM services, I called on Tuesday, I spoke to Juan, and Juan told me that I just need to ask for same day access and my staff and the name of the staff member, Nora or Erica, whoever the case might be.
Thank you so much.
Carlos has his hand.
Yeah, go ahead. Carlos?
Hello, thank you for being here. So I have 2 questions. I mean, it's one thing to have services that are available and great that you have bilingual staff, but there's also a stigma around mental health. So I'm wondering, how do you navigate around that, especially along certain cultural groups? And then in terms of the demographics of who you serve, I've been hearing some research about older men who are facing notions of suicide. I'm wondering, do you have a lot of those kind of calls?
I couldn't quite make that out.
So
Suicide and cultural barriers.
Yes.
stigma, cultural barriers, and then your experience with the number of older men who are having suicidal ideations.
Yes, I mean, that's something that we see across the board, not just isolated to men, but particularly from certain cultural backgrounds. I mean, I'll speak for myself as a Hispanic man. We are used to dealing with things in the family. Where you know, and even I'm from Puerto Rico, for those of you that might be wondering, we're used to dealing with things in the family and shit, and basically expressing that you're having difficulties, whether it's with depression, anxiety, whatever the case might be, can be quite stigmatizing. Having said that, that's why our team is highly trained in engaging clients, not just clients overall, but elderly clients. And one of the things that we try to do is actually provide clients the opportunity to say, hey, why don't you just come in, hear a little bit about our program. If it sounds like a good match for you, then we can get you right in. If it's something that you need to think about, which happens at times, no worries. How about I'll give you a call in a couple of days, or here's my card. You can call me if you have any questions. We also work very closely with a lot of other county programs. One program that I'm not sure if you have heard about it, because it's a fairly new one. It's called the Mobile Outreach Support Team, or MOST for short. which is basically aims to minimize as well the involvement of law enforcement in the community whenever there's a mental health crisis. So a team will go to the community and speak to the person in crisis and try to actually avoid hospitalization by helping them to connect with services. And a lot of the times that includes bringing them over to us so that we can let them know about this is what we can do. Because a lot of people have the notion that accessing mental health services is how people are going to think I'm crazy and they're just going to give me meds and I'm going to feel this way or that way. It's like, no, this is why in all of our initial appointments, the first thing that we do is an individualized treatment plan where we ask the client, like, tell me, like, what do you want to work on? What is it that you feel that you need support with? At our initial appointment at the same day access, we just do an assessment. We're not doing necessarily a treatment plan in the sense, a long-term treatment plan. We do a short-term treatment plan where we say, tell me what is it that you're interested in. And if a client says, I want case management and psychiatry services, I'm not ready to do therapy yet, not a problem. If you change your mind, we can add that in the future. But for now, let's focus on what you want to work on. Did that answer your question? And I think there was a second question, right?
And I think you might have answered, actually. I was going to ask about, for people who don't even know where to contact anyone in Arlington County, but they know about 988 and they call the National Crisis Line.
Mhm.
They may be in crisis for suicide or something else. Are you the local point of contact for when people call, or how do you connect to 988 in any way? Or is it the most
That
that
would-
will reach out to those?
So the MOST team is a mobile outreach team, right? That works as in the community starting at 1 p.m. They work from 1 to 9 currently. However, for clients that are actively experiencing a mental health crisis, let's say that somebody's experiencing suicidal ideation, the point of contact in the county would be our emergency services at 703-228-5160. And essentially, that's a 24-hour service, of course. Clients can call and say, hey, this is what's going on. I need services. And, contrary to popular belief, the purpose of emergency services is not to hospitalize people. It's actually to do quite the opposite, to try to keep somebody from getting to that point by helping them connect with services. And that could be if somebody needs SAM services, or if because they're 60 years or older, or if they are under the age of 60 and they need to connect with intensive outpatient treatment programs through their services at BHT. That is actually what they do as well. And I can speak from experience because I did the job in Fairfax County and I worked in the mobile, we call them mobile crisis team unit. And that was precisely my job, to go into the community, people's workplaces at times, anywhere where they were, and actually do a risk assessment first of all, and try to determine what does this person in front of me need at this moment in time. If they can maintain safety, fantastic. Let's connect them with services. If they cannot maintain safety, that's when we actually explore higher levels of care.
You had said that the cost for individuals is on a sliding scale. What happens for those people who are on Medicare Advantage plans in which you're not in network? I'm thinking of, it's like, as long as the Kaiser plan, you can only go to Kaiser. How do you?
Well, that might be a bit of a question that's more, a little bit over my head, that's more directed toward the Financial Management Bureau, but nevertheless, I'll let you know that if somebody has Medicare, Medicaid, that's all I care about. If essentially, even if for clients that have had difficulty, they might have third-party insurers and they have all of those, I cannot access care. A lot of the times what we do is actually we have our client in the office during same day access and we'll start calling with them in the office. So, and that's something that, again, we have to be, we want to help clients access support services if they happen to have, like, for instance, Blue Cross Blue Shield or Kaiser, that they tend to manage everything in-house. We actually will sit with the client, make those phone calls, trying to get an appointment. If for whatever the reason the client is not able to access services, we still admit it. And then that's when after a client has been deemed to meet eligibility criteria and they are in the process of being admitted to SAM services, our financial management bureau will reach out to them as well. It can be either right there and then in the office, or it can be done afterwards, because a lot of the times, the same day access can be a little bit time consuming, right? We're trying to get a lot of information in a short time frame. But our financial management bureau will either work with the client to try to do a financial assessment and determine on a sliding scale what they're able to, what fee that can they be provided as well.
Don't mean to interrupt the presentation. Do you coordinate with RAFT? And the second question, do you advocate for patients? So
Oh, yeah.
we knew of someone who was, in a senior housing facility and all of a sudden they're being threatened with eviction. Are you able to help that client advocate to stay in the facility?
Oh, yeah.
Okay.
That was my week last week, okay? That's all I'm gonna say. I will tell you, last week alone, must have spent at least 6 hours in the week combined advocating for one client. But yeah, we work very closely with RAFT. We're also very lucky that one of our coworkers recently was promoted to the RAFT program manager position as well. And basically I was actually speaking to, her name is Shandia Johnson. And I was actually speaking to her last week about this particular client, which is exactly what you just described. This person is in an assisted living facility, but because of increasing high-risk behaviors, they are actually in the process of being not formally evicted, but they have been given a 30-day notice. And essentially has taken a lot of phone calls with the assisted living facility that they're currently at, the assisted living facility that we are currently trying to get them admitted into, as well as how to coordinate all the transition, the care coordination and the movement of their possessions. So it's a lot of coordination for sure, and a lot of advocacy, because as I think I'm getting ahead of myself a little bit, but that's one of the highest needs that we currently have, assisted living facilities that will accept clients with a diagnosis of severe mental illnesses. Yes.
I was just wondering what ways, if any, are you or your team members spreading the word about this program to folks who may benefit? Do you do outreach in general, or go to community centers, senior centers programs?
Yeah, and I believe that was one of the questions that we received. It's okay. Absolutely, absolutely. So we can actually, if we hold that one,
We're gonna let you go.
sounds good. This is just a little bit of information. Usually clients will ask us like, okay, what documents do I need to bring? And the truth is that most of the time clients don't need to bring documents. We will still do an assessment. Having said that, it can slow down the process. So if somebody is calling the 1700 number and saying, oh, I can come in on Thursday, I'm like, great. What time do you think you might come? Okay, well, this is the staff member that's going to be on duty that day. When you come, try your best to bring the following document. The first thing is we ask for an ID. So a government ID, proof of current address. The reason why, and obviously a lot of the times, number one and number two are all together because folks will arrive with the DMV IDs. So we'll have both 2 and 1. But the reason why we ask for a proof of current address is because we need to make sure that we're servicing residents in Arlington County, and that we're not necessarily, if for instance, if a client that resides in Fairfax County comes to us, we're not able to do home visits in Fairfax County ourselves. So we want to make, and even if that were the case, we would then redirect them to their same day access. The other thing that people ask a lot of the times is like, what if the client is homeless? Well, the client, and we have a lot of our clientele that, not a lot, but a significant amount of folks in our caseloads are or have been homeless at one point. So usually this is where we try to connect clients with some of our local shelters, whether it's RPC, Path Forward, where they actually are also assigned a case manager as well to assist them with housing as well. But what we will need then is just a letter from the shelter. A letter from the shelter that says, yes, John Smith has been admitted to RPC or Path Forward. So that way we know how to get in touch with the client, and we have actually identified this is an individual that is residing in Arlington County. Proof of income. This is for our Financial Management Bureau so that we can actually make a determination in terms of the sliding scale fees. That could be a Social Security eligibility letter, pay stubs, W-2, whatever the case might be. Insurance cards, bottles of any current medications. This is so that when we're doing our assessment, we can actually write on our initial assessment for what medications they might be currently on. They meet with our psychiatrist. Our psychiatrist has also had an opportunity to review not just the history of this new client, but also the medications, and actually is in a better position to do their own assessment. This is the bottles of medication. I just want to clarify, this is not required. But it's ideal. But we're talking about somebody that is calling the 1700 number asking for information. If they are currently being discharged from the hospital, or let me clarify that. If they have been discharged from the hospital, say I'm back home and they told me to call this number to try to get connected with services, say, fantastic. Come and did they give you any paperwork? Yes, they did. Bring it with you as well. And any prior mental health or substance use treatment records that they might have in their possession. Yes.
Do you deal with the National Addiction Center here? Used to be called Phoenix.
Phoenix House?
Yes.
I think they may have changed the name.
Yes, but I can't remember the name. It's complicated.
National Capital Treatment.
National, yes, thank you. Yes, we do. Yes, we do. We are currently, it's funny, you guys are bringing up a lot of clients that are currently in the process. We actually currently have a client that's being discharged in residential substance use treatment program. And we have been coordinating with their providers and in their treatment program so that they can actually safely discharge and transition over to us. But before we do that, we also have to make sure, okay, well, what kind of level of care this individual will need, because we don't want, going from a residential treatment program where you're being receiving support services on a daily basis throughout the entire day, then discharging straight to an outpatient service. Sometimes that can be detrimental. So we want to make sure that there's additional services in place so that the client hopefully will not relapse.
Thank you.
So Mary Marshall Assisted Living Facility is one of our partners that we very closely work with. Is one of two assisted living facilities that we're, at least as far as I'm aware, in Arlington County. The difference is that Mary Marshall accepts clients that are 55 years and older that have been diagnosed with a severe mental illness. To my knowledge, there's no other facility that will accept clients diagnosed with SMIs in Arlington County. And one thing required for individuals seeking admission to Mary Marshall is that they will have not just a case manager within Mary Marshall to assist them with the day-to-day, they are required to have a CSB provider. That can be, usually is a clinician or a case manager, but it can, for those clients that have maintained a long period of stability, and they say, I don't really want to have a case manager anymore, they are usually connected with at least one provider, and a lot of the times that may be also our psychiatrists as well.
I'm
Yes.
sorry, Juan, this is Maimuna. Good morning. Great presentation. I just want to make a small note. It's 52 beds instead of 54.
Oh, you're absolutely right. My apologies. I meant to write 52 beds. 52 beds. Thank you, Maimuna. Make a note of that, Helen. Version
Got all your
2.0.
corrections.
All my corrections. Thank you.
You use the initial CSB. What does that stand for?
Community Services Board. So basically all the programs that we offer. So currently, our team has, there are 31 clients that are currently residing at Mary Marshall Assisted Living Facility that receive therapy, case management, and or psychiatry services. There are current vacancies at Mary Marshall, which is usually not the case. So if you know of anybody that is in need of assisted living facility care and have a history of mental health difficulties, this is the time to basically call and seek services. Now, in order for a person cannot go from the community straight into Mary Marshall. They still need to be admitted to our program. So all they have to do is just come to same day access. And then we actually can help them connect with Mary Marshall. And I think the last one is that we just work very closely with Mary Marshall providers in terms of helping clients not just access services. We actually have like monthly meetings and usually I feel like I'm meeting with them much more than monthly. I'm actually meeting with them later this afternoon to discuss a client that's currently in the process of being referred and also to coordinate ancillary services.
I've got one question.
Yes.
We keep using the phrase serious mental illnesses. How do you make that distinction between mental illness and medium mental illness and serious mental illness?
That is a great question. And it's one that when I first came in, I was thinking, okay, well, where's the line, right? It's not easy to answer that question. The way that we look at serious mental illnesses, usually because it can be, people may think of anxiety as, that's not serious, it's just anxiety. But anxiety can be incredibly debilitating, especially if we're talking about something like generalized anxiety disorder that impairs somebody's level of functioning, ability to leave their home, self-care, depression as well. There's different levels of depression. We also talk about psychotic disorders, for example. But the way that we try to understand if it's severe or not is if, because of the symptoms of a mental health diagnosis, somebody experiences severe functional difficulties, that's when we're actually thinking, okay, this might be a severe mental illness. As well, we look at people's, during our same day access assessment, we inquire about people's mental health history, how long they have been receiving services, what has been successful, not successful, and if they have any history of inpatient treatment as well. Because that's usually a pretty big indicator. If somebody says, well, I'm feeling a little bit anxious. Okay, well, have you ever been in the hospital? Yeah, I was hospitalized 3 times last year. Okay, that's more than a little bit. So, does that help answer your question? So some of the questions that I received in advance is how does SAM intersect with the CSB? Does SAM coordinate with any other county mental health services? And the answer is yes. Yes, we coordinate very closely. We're part of the CSB ourselves, so we are in constant communication, not just with CSB programs, such as our colleagues across the street at the BHD, such as emergency services. A lot of the times we find ourselves making linkages, that is a word, linkages to substance use treatment programs, emergency services. We work very closely with the MOST team as well, particularly not just when, especially if we believe that the client may need additional support or a wellness check at times, we can also coordinate with our colleagues across the street. We also work very closely with our current non-CSB programs. That is the Economic Independence Bureau for folks that are experiencing financial difficulties. Nursing case management is a program that we work very, very closely with because a lot of our seniors have chronic medical issues that basically impact on their mental health. And the point is that they need additional support in the home, as well as the community living program, which is a home-based program that is basically aimed at assisting clients with day-to-day daily functioning. Even though the they don't receive daily support under this program. Usually they might receive several hours a week of support where somebody an aide will come to their home, help them clean, help them do their laundry, help them meals at times as well. So again, we're trying to incorporate different support services. We work extremely close with all the programs because the truth is nobody can do it alone.
Can you hear me?
Did you ever be involved with nursing home residents?
Say that again, sorry?
Did you ever be involved with nursing home residents?
So nursing home, when somebody is in a higher level of care, such as a nursing home, all their needs are being met, right? That does not mean that we cannot provide, for instance, like therapy services in the nursing home. We can. We have worked very closely as well with Cherrydale Nursing Home Services here. Cherrydale Nursing Home. I can never get the names right.
Oh, sure.
But usually when clients have been admitted to a higher level of care, basically we continue to coordinate with their team, but we don't necessarily continue to provide the intensive level of case management at times because everything is being handled under one roof. But therapy services, that's something that we can certainly provide. And that can be facilitated by going to the nursing home. That can be facilitated via Zoom sessions as well, if the client is able to navigate technology.
This is Claire Jacobson. I'm on the phone. Can you hear me?
Yes, Claire, go ahead.
Juan, I'm on the phone, so you can't see me. You earlier you mentioned Mary Marshall, of which I'm very familiar with, but since I'm on their advisory council, but you also said there were two ALFs. You mentioned Mary Marshall, and I was curious to hear which the name of the other ALF.
Oh, yes. It's a Culpeper Gardens Assisted Living Facility.
Okay, Culpeper ALF. All right, I suspected that, but I wasn't sure. Thank you. Thank you.
Okay, and Erica, I think I saw your hand go up.
Yes, thank you. Thank you. Can you hear me?
Yes.
Thank you so much, Juan. And I too am a member of the Mary Marshall Assisted Living Residents Advisory Council, as is Ann Herman. There are three of us that are online here today. But I wanted to ask you about RAFT and the intersection and coordination of the SAM program with the RAFT program.
Yes. So RAFT, one of the case managers that we currently have on the team, actually, that they were recently promoted actually to the new position that we just created. We were able to obtain. It's called. She provides intensive case management services. Her name is Caitlin Stoffer, and she also serves as the discharge planner for older adults for Arlington. And Caitlin currently maintains very close working relationships, particularly with like Piedmont Geriatric Hospital. And when clients are discharging from a state hospital, such as Piedmont, this is where we're looking to coordinate care and coordinate with RAFT, for example, to make sure that they have a step-down process. And a lot of the times it's about identifying facilities that they can safely discharge to. As I mentioned earlier, affordable not affordable housing, like assisted living facilities is a big need. So at times clients, we need to explore resources outside of the county area. And this is where RAFT and our discharge planning staff come in. Does that answer your question?
Yes, thank you so much.
Sure.
Juan, this is Maimuna.
Yes.
Great presentation. Thank you. Just to let you all know, Juan has just had his first year anniversary with us. So congratulations on that again. But can you speak to informed consent?
And it's taken, I wouldn't say it's taken the full year, even though I'm an Arlington County returnee. I previously worked with the assertive community treatment for 2 years. When I came after 10 years, I came back and I had to relearn everything. There's so many programs in Arlington County. I thought I'm going to hit the ground running. No, it takes a little bit of time to get acquainted with all the programs that we offer.
Juan, can you speak to informed consent?
Anything in particular?
For the clients, even though they're referred to us, they still have to,
Oh, yes.
yeah,
Thank you.
want to engage. Okay.
Yes, thank you. That's a very, very important point. So a lot of the times we get, especially when we are being routed phone calls through the 1700 number, we'll get phone calls from family members. They'll say, oh, I'm looking for services for my dad or for my mom or my aunt, and they need services, but they're not willing. They're not willing to get help. That is usually it's extremely challenging, not just for the family members, but it's also challenging for us because unfortunately we don't have a whole lot of options. Our services are 100% voluntary. So in order to access services, the client needs to be able to actually do an assessment with our clinician, with our same-day access clinician in the office. For those clients that do present mobility issues, we can go to them. However, we strongly try to encourage folks to come to our office because we do have, given our, essentially, we need to try to make sure that they come in so that way they can be seen by our nurse as soon as they're done doing this, the psychosocial clinician. We can actually get them to meet as well with our financial management bureau so that they can do a financial assessment. So everything under one roof works very, very well. But for those clients that do experience severe mobility issues, we can also essentially coordinate assessments in the home. Now, with informed consent, unfortunately, for those folks that are resistant to accepting services, we don't have a lot of options. We cannot force them to engage in services. But we can, and we do, reach out to those folks. We will make like an outreach call and say, hi, my name is Juan Cotto. I'm with the Senior Adult Mental Health Team. I'm calling because I received a phone call from your daughter. And she asked me to give you a call to tell you a little bit about these services that we provide. And again, the idea here is to use some motivational interviewing techniques to try to get the client to at least be willing to hear us out, to consider the possibility that this might be a beneficial services for them. And it's something that we do every week. So a lot of the times the client might change their mind and say, okay, I'll give it a shot because, you have a doctor, so at least I'll meet with the doctor. I'm like, okay, we'll have you come in for an assessment. There's no guarantee, right? We still need to do our assessment. And then assuming that you qualify for services, then we can actually get you an appointment with our doctor, open you to case management, and then we take it one step at a time. Again, all of our treatment plans are individualized, so we cannot force treatment or therapy or case management on somebody that doesn't want it. In those situations, unfortunately, where we see clients that are resistant to treatment, what can happen is that as the situation tends to worsen over time, they might come in contact with law enforcement or with the mobile outreach support team, the MOST team. That's something that we can also, that again, when they come in contact with an individual, they might actually help them be more willing as well to accept our service, or at least come in for an assessment and hear us out. At times, clients will also might experience hospitalization, and this is where the discharge planners, we work very closely, especially with VHC, with Virginia Hospital Center. They will call us and let us know, hey, I have this client, they're interested in being connected with services. We're discharging them on this day, and they mentioned that they can come to your office for an assessment at this time. Are you available? Absolutely. Once again, we give them the name of the clinician and say, okay, Juan will be on duty. When they come into the front desk, they can ask for Juan and same-day access. Yes.
So Juan, you touched on undocumented, they can fall through the cracks. Can you tell us a little bit about how, you reach out or publicize what you have and how they may, the way around, enter your services? Can you touch base on that? Because they could fall through the cracks.
Yeah, absolutely. A lot of the times what happens is that folks will come into, they will be already receiving some kind of support whether it's in the shelter or they have come asking about benefits, making inquiries regarding benefits that wondering if they qualify for those services. And that's when some of our colleagues for instance, at the ADRC will reach out to us and say, hey, this client came in, they don't qualify for some benefits because they don't have a permanent legal status currently, but they are interested in meeting with a doctor, getting some support. This is where we tend to help them connect with Sam as well. Now, how do we advertise, which I believe is one of the questions in the next slide. I'll come back to that one. Okay, I'll come back to that one.
So I think there was another online question with Anne, and then we're getting close on time.
Yep, no worries.
Yep, okay, so
Thank you.
Anne, did you have a
Okay,
question?
well, actually, I wanted to say or ask two things before we left that last slide. Can you hear me okay?
Yeah.
Yes.
Okay, because I'm getting feedback for some reason. Okay, but as long as you can hear me. One is about RAFT. I think when you mentioned Caitlin Stauffer, you said about reaching outside of Arlington. But I wanted to clarify, we're talking about the region because RAFT is a regional service, or I wanted to ask the question. We're really talking about the region, not the whole state, right?
Yes. Yes.
Okay, and then secondly, about CSB, because this is sometimes very confusing even to people who are on the CSB commission. The CSB here, in case some of you don't realize that there is a distinction, because CSB, of course, is a behavioral health service. But we also have a CSB commission that is a commission just in the same sense as the Commission on Aging. And I just wanted to take the opportunity, since so many of us are sitting here, to say that, because very often, as I say, even people on the CSB can get confused about that. So it's not so much a question as two footnotes I wanted to add. Thank you.
Thank you. Can we go back real quick
Yeah.
to don't know if I answered the previous second question. So how is Sam connecting with county and nonprofit partners to provide mental health services to older adults who are homeless? I think I spoke a little bit about this earlier. So helping clients get connected with the Aging and Disability Resource Center, which provides short-term case management, assisting clients finding housing, applying for housing grants, accessing, being referred for shelters. Adult services does also provide a lot of case management, but it's more of a long-term basis. Because a lot of the times we'll have clients that will come in and say, I just need help applying for a housing grant. So that's something that can be addressed through a short-term case management service. But for somebody that requires ongoing support, we're thinking usually like more than 3 months or more. This is when our ADRC team can work internally as well to refer them for adult services. We obviously work very closely with the Area Agency on Aging, and we provide, like I mentioned earlier, a link. We do linkage service and collaborate very closely with the local shelters. Some of the nonprofit organizations that we collaborate with that can include particularly places of worship, whether it's churches, synagogues. Essentially, this has a double function where clients can actually not only access supports in the community, but also can and that could be like in the sense of financial support. For instance, I'm currently working with a client that doesn't have enough financial funds. We have assisted them with paying for the moves and accessing multiple services, but now they need a new bed. So their synagogue is actually helping them get financial assistance to pay for a bed. And also has an added benefit that it reduces isolation. And then I mentioned that we work very closely with local and regional psychiatric hospitals, such as Virginia Hospital Center, Dominion Hospital, the Inova System, and Piedmont Geriatric Hospital. How are you reaching out to older adults living in single-family homes and multifamily communities? So we do it in multiple ways. We do participate in the ADS and the Aging and Disability Services Division Outreach Committee, And there are events that tend to be done throughout the year. One of them is coming up, the Community Engagement Forum, which a lot of you might be familiar with in March. And we also participate in the Arlington County Fair. We actually had a stand and we had staff member participate in the Arlington County Fair and just providing information about senior adult mental health. And we also reach out, because we work so closely with some of the two assisted living facilities at Culpeper Gardens. We have clients already there. So one of the things that we do, and I do it myself, I actually, when we go there and staff are saying, hey, we have a client here that's not doing so well, can they receive support services through you as well? So again, a lot of our job is actually letting folks know what is it that we do. If we don't do it, if we don't provide that particular service, then we actually help them connect with the program or the person that are able to assist.
Okay, and can I just add, the Agency on Aging too goes out and does quite a few outreach events. And so we will take information, and I've given you each a copy of the newly published Senior Adult Mental Health brochure. At a minimum, we take that out with us, make it available to people, so that they know that that service is available too.
Does anyone go out to Arlington Mill and have this in Spanish?
We
So
do have
it is
it.
available in Spanish.
We
yes.
do have it in Spanish. I was double checking if the address was on this one. It is on this one. It's on the back. Right there for a second. And what are you doing to combat the epidemic of social isolation? This is a huge part for us. A lot of what we do, as I mentioned earlier, is linking clients to service. We can provide any given client therapy once a week as much as we can, but if they spend the rest of their day, the rest of their week on their own, it's hard to get traction on depressive symptoms, for example. So what we do is link clients to services such as the adult day program, the 60+ social cafes, Arlington Neighborhood Village, which is a huge help to our clients, and faith-based organizations. Like, for example, one of my clients that experienced a great deal of anxiety and depression, one of my interventions was helping them connect with their local church. And just that, looking forward to leaving their home and going to church on Sunday was something that had a huge impact on their quality of life. The issue always is consistency. We want to make sure that these are interventions that we can assist our clients in remaining consistent, so that it's not just a one-off and then I felt great, now I'm going back to isolating. One of the things that we help clients with, as well as linking clients to transportation services, that could be Arlington Star for medical appointments, Metro Access, Super Senior Taxi. And at times unfortunately, we're not able ourselves to transport clients to, for instance, a social cafe on a consistent basis. But one of we have staff that in one of their case management services is they'll take a client grocery shopping, or they have taken the client grocery shopping, for example. But once again, what we're trying to do is get the clients connected with other support services. Because yeah, staying in the home just tends to make everything worse. And the CDC recently released a report noting the rise in suicide among adult men. How does Arlington compare, and what other mental health concerns are most prevalent among older adults in Arlington? So the first thing that we do is, after we meet with the client and we put face-to-face appointments, it can be in person, it can be via telehealth. Every county staff is required to do a risk assessment. And we actually document not only do we write our progress note, we actually have 2 additional documents that we document whether somebody presented any risk issues. For clients that have engaged in, for example, in suicidal attempts, even though we have been collaborating in the process, not just with the client while they're in the hospital, there are other treatment providers, we actually have internal reviews to basically explore, did we miss something? So, and this is what we call sentinel event reviews. Risk and sentinel event reviews, just for clarification, includes other events that can perhaps be life-threatening, but suicide kind of falls under that category. Risk management plans for identify high-risk clients. So if somebody is considered to be moderate, high risk, we are required to provide develop a risk management plan where we basically explore with the client what are some of the safety strategies that they can access during times of high stress. Because again, yes, it's easy to basically coordinate a hospital admission. It's very easy. It's not sustainable. So we need to work with the clients and make their care individualized so that we can actually help them succeed by staying out of the hospital, in the community, maintaining safety and accessing support services. We also have in the county what is called the Zero Suicide Committee. Has been running since 2015. It's composed of staff throughout the CSB. It's not just, we have SAM staff that are part of that committee, but we also collaborate very closely with our colleagues at BHD. And in that committee, it also includes individuals themselves that have lived experiences of suicide behaviors. And the efforts are focused on identification, training, and client engagement. The committee also provides or organizes trainings for staff on the CAMS, or the Collaborative Assessment and Management of Suicidality, which is sponsored by DBHDS. And essentially is a treatment intervention specifically focused on suicide assessment and treatment. And the county also provides mental health first aid education to Arlington County residents, including those that speak Spanish. Are there any other pressing needs? This is my favorite part. It's the status part, but it's my favorite part. I don't think I'm going to tell you anything new, but affordable housing is just a huge, huge need. To give you a little bit of perspective, I have a client that receives $970 of SSI. That's all they have. All they have. The cheapest apartment that I could find this person was $1,570. How is somebody supposed to live on that? So my job required me to access, be able to refer her to different services within the county, not just for SNAP benefits, making sure that she's accessing pharmacy renewal, making sure that she has doctor's appointments, PCP providers, all that stuff, but housing grant vouchers as well. We do have programs out there that work as well, such as the permanent supportive housing, but again, the need is overwhelming for affordable housing. I mentioned previously that assisted living facilities for individuals diagnosed with severe mental illnesses is a huge, huge need. I think assisted living facilities, period, are in need. Exactly, thank you. Affordable ones are a huge need overall, but outside of the Mary Marshall assisted living residence, I'm not familiar with an assisted that will consider or admit clients diagnosed with mental health, severe mental health illnesses in Arlington County. Outside of the county, I'm not familiar. Another need, transportation services to recreational centers such as the social cafes. Now the 60+ social cafes also provide transportation for residents where they actually will go pick them up and bring them so that they can participate in activities. So while the resource is there at times, last time I checked, those programs had a wait list. So if a client can get themselves there, they might be able to access services. But unfortunately, there's a lot of clients that access these services, and the transportation, they're not able to essentially pick everybody up. So, and especially as you have looked outside, it's all icy. Are you gonna get dressed and walk 2 miles to go to the social cafe? Probably not. So transportation services remains a huge part, a huge need. Price stabilization units to prevent inpatient treatment, another huge need, which if I recall correctly, I believe there's one in development and associated at VHC or in collaboration with VHC. Maimuna, you might have more information on this. Unfortunately, I don't recall the details. But the only crisis stabilization unit that I am aware of currently functioning is in Fairfax County, and it's called Wellness Circle. I actually on Friday, I was speaking with emergency services regarding a client, and I asked this question specifically, and they told me nothing outside of Wellness Circle. So again, our job is to try to minimize inpatient treatment, try to coordinate, assist client in accessing services. But in times of crisis, we don't have a lot of resources other than inpatient treatment. So having crisis stabilization units available to clients overall, but especially our geriatric populations would be a huge advantage. Or huge benefit, I should say. And what are the gaps in senior adult mental health, and how can the Commission on Aging help close those gaps? The first thing is collaboration and sharing of information. You know, just like we are familiar with resources that you're not familiar with, I'm sure that you are familiar with resources that we have no clue about, probably. So just continuing to collaborate and share information. If there's a new service out there, please, I want to hear about it. My team wants to hear about it. And last but not least, advocacy for new funding positions. There's our population will continue to age. So we expect, we are seeing it currently that the demand for senior adult mental health services is increasing and will continue to increase as we continue to live longer and longer. So advocacy for new funding positions, like I mentioned, we were recently awarded a new position through DBHDS for intensive case management services, and we were thrilled about that. So, but we can always do more.
Great, thank you.
Contact information on the first slide as well.
Yes, we'll distribute the slides.
Yeah, I will make the notes, the updates, and I will send it to Helen and Helen.
Perfect.
All right.
Yeah, thank you very much, Juan.
Wonderful.
Yeah, thanks for everything that you do, and thanks.
Great, thank you.
All right, everyone, we're gonna take a 5-minute break and then, so you can warm up or whatever.
All right, we're ready to get started again.
All righty. So before we go to the minutes, I just wanted to thank the Healthcare Committee for a great guest and for doing the prepared questions. And I mean, very important topic. Yeah.
It was over.
Yeah, that was great. And yeah, I won't prolong this, but in my original intro, I talked about the age-friendly goals and everything that we're working on. So thank you for all your time and effort. I know most of the work that we do probably happens away from these meetings. So thank you for that. So next, the meeting minutes, should we move on?
Yes, so there is one update that needs to be made to the December minutes that I'm aware of. We need to add that Claire Jacobson was in attendance at the December meeting. But other than that, are there other updates that are needed or changes?
All right, if not, do we have a motion and a second?
I so move.
Second.
Great. All in favor, say aye. Opposed? Right, meetings are approved. Minutes are approved. No additional shares report. And go on to the staff report.
Staff reports, okay. All right, so when I sat down Friday to figure out what I was going to talk about today, I thought I don't really have very much. And then I started writing it down and I have a pile. So bear with me, everyone. Thank you. So first of all, the new year has started off on a high note. For those of you who have heard about the warehouse fire in Alexandria on January 2nd, you may or may not have heard that that fire affected our nutrition programs. The vendor that we use for all of our nutrition programs is Jeffrey's Catering, and they are in the warehouse right next door to the one that burned. To my knowledge, I'm not sure that they've gotten in to see how much damage has been done. There was serious structural damage to the warehouse. So anyway, so we had to do a little quick step right as we got into the new year. We were able to put together a couple of emergency procurements and got our social 60 plus cafes and our adult day program covered by a local Arlington company called the Good Food Company. They specialize in meals for daycares and schools. And so they have the infrastructure to do what we needed them to do for the social 60 plus cafes and for adult day. And then for our home delivered meals, we contacted Mom's Meals. And Mom's Meals was able to ship out 14 meals to cover the 2-week period for the individuals who are connected to Meals on Wheels. Other programs that were affected as well, our Clarendon House, which is our day program in behavioral health, uses Jeffrey's for meals. And New Hope Housing, which is one of the shelters, also has 3 meals a day delivered by Jeffrey's. So quite a big impact. And not just Arlington, but Fairfax and Alexandria City also use Jeffrey's. So big impact across the region. I am happy to report that Jeffrey's has identified temporary space. They resumed their deliveries to the social 60 plus cafes in the adult day program last week, as well as some of the other programs. And then this week they're resuming their normal deliveries to our Meals on Wheels program. So super grateful for that. Lots of support from a lot of people. And so I'd like to just give a shout out to Jennifer Collins, Michael DiGeronimo, the whole Meals on Wheels crew. They just really came together and helped us get through it. Jim Baker and Amanda Meyer for putting together the emergency procurements. You know, just couldn't have done it without the team effort that we had. So to my knowledge, no one has gone hungry. We have had a few people call to say that they were getting low on food. We were able to deliver extra emergency shelf-stable food. Sorry, and this is, you know, on the good news thing, we had just taken boxes of 5 meals to the home delivered meals people at the beginning of December. So they still had some of that emergency food. We took extra out to those who were identified as needing extra food. And, some of the like emergency contacts for people were able to bring food to their loved one to make sure no one went hungry. Link.
County is assuming the responsibility for delivery of the Meals on Wheels.
So Meals on Wheels of Arlington is who does the delivery, but the Mom's Meals piece of it was delivered by either FedEx or UPS.
The local church involvement before the pandemic.
So the Meals on Wheels of Arlington still operates out of that Presbyterian church on Carlin Springs Road, right? That's sort of their center of operations. So Jeffries brings the meal to that church, and then the Meals on Wheels volunteers come there and take them out around the county. So.
This
Okay.
goes to broad volunteer support.
Yes, yes, yep. Okay, any other questions on the nutrition program? I'm really happy that we're getting back to normal. But it has been an exciting start to our year. Okay, on to other topics. The county manager will release his proposed FY 2025 budget on Saturday, February 24th at the county board meeting. And so for those of you that have been around for a while, his releasing the budget kicks off a series of departmental work sessions. And generally, the Department of Human Services and the Community Planning, Housing and Development's work sessions are together. So I don't have the schedule for when that will be. It's usually around the second week of March. As soon as that schedule is released, I'll let you know. William and or Kathy will have the opportunity to give some comments during that meeting. Linda has done it for the last 2 years. It's generally a lot of good information packed into a 3-hour meeting. And so, but we'll make sure that William is well prepared when he goes to give his comments. And then speaking of budget, we also, around this time, we have our annual budget committee meeting. That is the time when Jim Baker, our administrative officer, and Jennifer Collins, who is part of the 55+ programs, give an update on what the fiscal year 2025 budget looks like. And, so give a high level overview of that and really honing in on the impacts to agencies. So that meeting is now scheduled for Monday, March the 4th at 10:30. And anybody who is interested is welcome to attend. It's part of the executive committee of this, but anyone is welcome to attend. And that will be added to the calendar of events for the next release. Okay. All right, we've talked a little bit about the community engagement forum. Just a reminder, it's March 18th at Lover Run. We have set a theme, and so we're going to have a theme of a roadmap to age-friendly Arlington. And as we've talked about, it will be focused on the next age-friendly plan. Excuse me, we are planning to have 2 satellite sites. Culpeper Garden is confirmed, and we're hoping to hold the second one at Arlington Mill, but as soon as we have more information, we'll pass that along. I attended the board meeting for the Virginia Association of Area Agencies on Aging on January 16th. A lot of talk about the budget priority for a $5 million increase to aging services. That budget has got sponsors in the House and in the Senate. So, we'll see where that goes. There's a lot of advocating for that going on right now. And this is in addition to the $700,000 that was added last year. So we're doing a real big ask for some additional funding statewide for aging services. And I would just like to thank Roland again for, he testified during one of the public hearings in support of this $5 million ask. So thank you to Roland for that. Also at the V4A board meeting, we had a presentation on the Virginia Dementia State Plan. So that has now officially been released, and I will include that with the follow-up information to the meeting. I received a PDF of that plan, and so I will include that. Okay. A couple transportation updates. First of all, hopefully you are all signed up for Arlington Alerts. to get emergency updates related to weather, severe travel disruptions or county operations. Just you get a text to your phone or an email, and so you're in the know of what's happening. We have talked in the past about changes to STAR operations, and there was the survey that was sent out. Apparently, they're doing now an open house on January 31st related to the STAR operations. And it says they'll present feedback plus operational data to help inform potential service recommendations. So that is Wednesday, January 31st from 6:30 to 7:30 at the Central Library. And then also wanted to just point out that the free rush hour service on ART buses is continuing. Rides are free on weekdays during rush hours in peak directions. So for more information on which routes are free at what times, you can go to the ART page. Okay. And then the Deputy Commissioner for Aging Services is finally on board and coming up to speed quickly. She attended our B4A meeting all day last week. So it was great to have her with us and, do a little educating on who we are and what we do. She will be coming to Arlington for a one-on-one visit. And so we'll be looking to schedule that probably in the spring. And then my last go ahead.
Helen, could you give us a little background? Where did she come from? Virginia?
So she, don't
want to put you on the spot.
She apparently went to VCU and spent some time working in Richmond. She has been on the West Coast for some time, working in nonprofits, but she's got a very broad history in aging services, homeless services, and other topic areas. So that's as much as I can remember,
Okay.
and I will send out other information. Okay. Let me just make sure I have nothing else. Erica asked me to comment on the Commonwealth Council on Aging. The Virginia Center on Aging's annual update will be Wednesday at 9 a.m. And so, please attend if you are able. It is virtual. Is this like their legislative update, Erica, or?
No, it's kind of a state of the aging annual update.
Okay, all right, thank you.
What was the date again?
It's Wednesday, January, so this Wednesday at 9 a.m. And I'll send the link out this afternoon. I also saw that the Senate Special Committee on Aging is doing a hearing to learn more about the assisted living industry. So that is Thursday, January 25th. And there's a link on the Senate Special Committee on Aging website if you want to listen in.
That US?
Yes, no, US Senate. Yep. All right. Okay, so any other questions for me? I do want to make just one quick note. A couple of you have asked, you've seen an out of office for Rachel. Rachel is fine. She's just taking some personal leave over the next couple months and she will most likely be back in. So, any questions for me?
You for so much effort and work. Tell her we miss her.
I will. Thank you. No, Mamuna has had to leave, so I did check with her and there was nothing beyond this to add. So that's
Thank you so much, Helen.
sure.
For wearing so many hats. I know there's a lot of work that's being done on age friendly, and to the extent that you'd like to give a top line update, I'd welcome doing so, and I'll start from that end. So Charlie, would you like to give any top end highlights if you care to?
Work group on the nursing home component to the plan met earlier this month, and we did some tweaking to the goals and objectives. I don't have copies of it with me, but it's still a work in progress. And I had the committee now has a first draft of an action plan and the steps and the timing and all that to go with it, that we hope to meet in the next 2 weeks to kind of zero in on and try to have something we can share with the whole group.
Excellent, thank you. Audrey, how's it?
Housing is in good shape. Excuse me. We have filled out the table, so we've got all the steps and partnerships and collaborations for our 3 main goals. And we'll continue to refine that. Would love input. We are looking at ways to collaborate with other committees and inside and outside of. And
Yeah, thank you for that. Yeah.
good about this.
Yeah, thank you for that and for offering to, review other committees' goals. And so, yeah, that's very important. And just, discussing the goals and working on them just creates a lot of conversation within the committees. Do we have any questions for either Charlie or Audrey? Hey, Jim.
Yeah, our next quarterly meeting is on the 13th of February at 2 o'clock. I've invited the Disabled Advisory Commission through Courtney Sales, the Alexandria Commission, Transportation Committee, and Wendy invited Andrew Shaw from Independence, which is great. So we're going to have a lot of people there from outside of the committee. We're going to talk mainly about Metro access, and we have the WMATA manager of that program to speak to us. We're also going to be talking about audible signals problems. And Jim Feaster and I are going to be meeting with the county on the 15th of February on that complicated topic. So
Yeah, so thanks, Jim. Yep. It was pleasing to see on the mental health briefing that transportation was an enabler or it helps people access that.
yeah, it certainly affected my mental health.
Okay. But and especially for handicapped individuals, paratransit and the problems with just on-time predictable service. So yeah, look forward to engaging with WMATA on that. Anyone have questions regarding transportation? We got our healthcare folks. Who would care to any highlights that you guys want to?
So we 3 are here and we're looking for at least one more commissioner to join us. We have gone through the goals and we're starting to lay them out on paper. And at the same time, build out a list of partners that we want to learn more about. And whenever we publish that opportunity, if anyone wants to listen in. But I think we're making progress. We're brand new, so that we're a little slower than others, but I think we got it going on.
Yeah, that's great.
I think we aligned really well with what was presented today.
Right.
Dr. Quoto, around sharing of resources, maybe adding something around advocacy for funding new positions.
Yeah.
Exactly.
Yeah, we've seen a lot of the advocacy piece and the outreach and the collaboration, but that's really important. I mean, for example, this program never knew much about SAM previously, so that was a great education. Also that, the undocumented folks who can fall through the cracks because, you're, number one, you're scared, you're undocumented and you need help and perhaps you're, daughter and they're working, you're home alone, you don't speak the language, you have no money, blah, 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 so you can fall through the cracks. So Roland or Carlos, would you like to update on your committee's work?
Carlos, you want to get your hand at it? Mike?
It looks like he has dropped off.
All right, Roland then. To the extent you want.
Well, we have adopted a new name for the committee. That is the Aging Equity and Engagement Committee. Because we're now a merger of two committees. We have had a meeting and discussed pretty much, had a broad discussion on aging equity. And one of the things we concluded is that we're gonna have to look at that, narrow that down. So that we can have some pretty viable goals and objectives. So we've had one initial discussion on that. We have pretty much another one pretty much scheduled on that. We're also looking at fraud, and we are putting together pretty much a program pretty much to deal with that. And we're also looking at other initiatives as we look at pretty much LGBTQ plus older adults. So hopefully within the next couple of weeks, we'll be able to have something pretty much. We have something on paper, but hopefully what we'll be able to do is have some smaller, more viable objectives than the broad ones that we're pretty much looking at.
Yeah, do we have any questions or comments for Roland and the healthcare committee? Roland, thank you for, I didn't know you testified, so that was great, and thank you.
That was fun.
Yeah. Always use more funding, so. And YEP's the, refining, focusing the goal is very important. So thank you for doing that. And again, you guys are in the committee, just like with healthcare, and thank you for looking at perspectives that may not have been highlighted before. So am I missing anything? Is there anyone else on age? Oh, and want to thank Cynthia for everything that you've done to point us in the right direction, and of course to Kathy for leading that effort as well with Cynthia. So do we have any questions or comments, deadlines from Cynthia and or Kathy? For them.
Deadlines are in my report that is attached to you.
Yeah, please get the goals over.
Note.
Yeah. Please get them over to Cynthia by the end of the month. I forget the exact date, but so that we can get them out at the community engagement forum, get some feedback from attendees and the public. So any other age-friendly updates that I forgot? And I see that our three candidates, I believe they've all been had a chance to chat with Libby and Katja and Michael are here, and I think Catalina is online. So please reach out to them if you hadn't had a chance to. So thank you guys for joining us today. And with that, I'm going to transition over to any other old business that we need to bring up. Not seeing none. Any new business? Yeah, I don't see any either. Do we have any announcements? So I've received a few of the annual report bullets, so please keep sending them in and we will put those together. And unless there's anything else, I will adjourn the meeting. Or no, yes.
For the Commission on Aging.
Commission on Aging,
Okay.
yeah. For each of the committees to send over.
Got it.
All right. Thank you all for attending. Appreciate everything that you do. And see you next month.
Thanks, everyone.
Thank you.
And thanks for the donuts. So.
Yeah.